I have some technical difficulties. Just 1 second. Getting the camera set up here. Well, hello and good evening. Hello, everyone. Good evening, CAD, and welcome to this platform. I'm happy to welcome you all in tonight. For tonight's topic, public versus private, the health insurance. We have a wonderful presenter tonight. I'd like to introduce Shelley Barber. So welcome, and I'll turn it over to you. Thank you so much. I look forward to talking with you all tonight about the public and private healthcare system. So good evening, everyone. From not so sunny California, we are facing some strange days. We are having a smoky sky that's covering the sun, but I'd like to welcome folks that are from outside of California. Hello and good evening. I'm excited to be here tonight to talk with you about the difference between the public and private health insurance. And we're going to talk about open enrollment tonight as well. Tonight I'll be looking at my laptop, which is just adjacent to the computer where my camera is. So it's a little bit easier for me to track the presentation. So please excuse my distracted eyes, but that's typically how I present. You know, in person, I would be referring to a PowerPoint behind me, but now because of the age of COVID, everything has changed. And so I'll be directing my eyes towards you at the camera, but once in a while, I'll glance over to my PowerPoint. Tonight, we're going to talk about the healthcare insurance system, the private and the public system. For the private insurance, that is sponsored by the employer. You'll look at where anyone typically works. That could be a grocery store, or maybe the state of California, or maybe you work for a deaf school, or even a university. Also, self-employed folks like myself. I am a licensed therapist and work for myself. And for government insurance, are covered by Medicare and Medicaid. And we also have the SCHIP system. And I'll go into some more detail in just a bit about each of those. If you look at the chart that I have here on the screen, you can see the flow chart I've designed for you. You see the individual and then the business. And that connects to the healthcare service provider, which is the clinician, the hospital, or the healthcare provider, maybe even a counselor. The business would be where you work, typically a full-time job. If you're working part-time or less, or a contract worker, those folks would not qualify for this type of insurance. Next, you can see in the middle, you have government and private insurance. Private insurance is like Aetna, Kaiser, Blue Cross, things of that nature. Now, in terms of the business or individual, I want you to think about, say you work for a grocery store and you work full-time. They would typically offer you insurance as a benefit. They might have 2 to 4 different options for you to select from. Oh, actually, can you go back to the slide before? Yeah, thanks. We're going to stay on this slide for a minute. So we can take, for example, person A and person B. Both of those folks might work at the same grocery store, both being full-time employees. Person A, let's say, is a 25-year-old healthy person with no health concerns, no issues whatsoever. Whereas person B might be somebody in their 40s, maybe diabetic, and might have 1 or 2 other health issues where they would see the doctor regularly. Now, out of the list of options of health insurance, they would select one insurance plan. The grocery store would pay a certain premium, let's just say for the ease of numbers, $600 a month for that health insurance. But the health insurance total costs $800 a month. So if the grocery store covers $600 a month for person A, they would pay the balance of $200 a month to have that health insurance. Now, if we compare that with person B, oh, actually, let me back up here. With that monthly premium, if person A is paying $200, the grocery store is paying the balance of $600. That plan, say, has a $5,000 deductible. So person A must pay for the doctor's appointments and other amenities up to $5,000 in the year, and then the insurance would kick in and cover costs after that. Now let's compare that scenario with person B, the 40-year-old with diabetes who might have some other health issues, and they do typically go to the doctor quite often. If they pick a different insurance plan, they might pay, maybe the insurance company pays $600 and they would have to pay $400. And they might want a lower deductible, maybe $1,000 deductible or no deductible. It just depends on the insurance plan because, you know, each company has a host of different options for insurance plans. So person A might go to the doctor for a checkup, and that would cost, say, $150. And they're happy to pay that directly to the medical provider. And you can see that line, that arrow going straight across from the individual to the service provider. That's that $150. But say person A gets in a biking accident and they are rushed to the hospital. They have to use an ambulance, and then they have x-rays and emergency room visits. Say they even need a couple stitches. That hospital bill can total, say, $7,000 for the sake of this example. So person A would have to pay the first $5,000 of that $7,000 bill, and then the insurance would cover the remaining $2,000. Now, if we compare that scenario with person B, say they go to the doctor regularly and they have very healthy coverage, they have good benefits. Maybe they have a slight copay of $50 or $10 to $20 copay for each office visit. They pay that directly to the service provider, to the doctor. And you can see that the individual pays their premium toward the private insurance. And the insurance company then pays the hospital or the service provider, whether it's a clinic, a counselor, or a doctor. Then we move up a line to the taxes. Out of each paycheck, you might notice that there's a Social Security tax, there's a Medicare tax. Well, Social Security tax is for your retirement. There's a little bit put away every month that's taken out of your check to save for that until you're 65 or older, depending on the situation. It could be 67 or even 70. The government saves all of those payments that you make, and when you're ready to retire, they will pay you your Social Security retirement check back. The government pays Social Security to all retired people over the age of 65. The taxes cover the Medicare payments, Medicaid, the SCHIP, and the VA that we just saw, all under Medicare on the previous slide. That all comes out of the Medicare tax, out of your check. Medicare and Medicaid and CHIP and VA are all paid directly to the service provider, whether that's a hospital, a doctor, or a clinic. The government does pay some premiums to insurance companies, especially if they are nonprofit insurance companies or a nonprofit hospital, such as Blue Cross or Blue Shield. And that's different than a public hospital. I hope this point is clear. We're going to go ahead and move on from here. Now, in the United States, we have roughly 330 million people. Now, about 59 million people are on Medicare. And people under 65, there are 273 million people in that age bracket. The next category we have are military, which are veterans. And there are 12 million veterans. Now you can see in the middle where it says people under 65. That have employment-based insurance. There are 159 million in that category. And folks that have other coverage, which we'll talk about later. And then the underinsured are 30 million people, which is roughly immigrants or folks that moved to America who don't yet have citizenship, or people that don't want to pay for their own insurance. People that don't qualify for Medicare or Medicaid or CHIP are in that category. If they don't qualify for those programs, there's about 30 million people in that category. And then just up from that, you can see the Medicaid and the CHIP. And CHIP is the next category down. And then CA is not in there. But then the next group over it needs to be clear, for example, all the different categories here. Say you are in a car accident, or if you fall in a store and you sue that store, that grocery store is responsible to pay your bills. They carry insurance for those reasons. Or the driver that hit you has insurance that covers your healthcare costs. So I can explain more about that in a bit. Okay? Now, I did want to expand a bit on Medicare. For folks that don't have that or that are over the age of 65. Oh, we're on the next slide already. Yep, there we go. This is for people over the age of 65 or those folks that have a permanent disability, such as being deaf. Of course, we're not going to change that status. Or people that are in the end stages of renal disease. And renal disease is about your kidneys, typically folks in kidney failure. So Medicare will cover those three categories of folks. Now, once you retire from your job, congratulations. Your private insurance from your employment typically stops at your retirement. But now you qualify for Medicare. And this is a system that you've been paying into for upwards of 30 years or more. Remember, they're taking it out of each check. And so now you're finally getting that Medicare back. And Medicare has 4 parts: A, B, C, and D. Folks have options to add Medicare if they have Part A and D, or A and B, or A and C, or all 4. So the plan for Part A, it's based on how much you have worked, and you have an out-of-pocket expense for hospital stays. It's typically around $100, or sometimes it might be $1,000. It just depends on your insurance plan. If you are on a fixed amount, say you have an unforeseen incident, you can pay up to $2,000 for that hospital stay, then Medicare will pay the rest. Now let's move on to Part B. B covers physician care and other outpatient services, like doctor's appointments, counseling, and the like. It is an optional benefit. You are not required to have Part B, but a person must pay a monthly premium. And that might be $100 to $300. Then there's also a deductible and a copay and other things that might not be covered. They always have a list of what services you are willing to pay for. If you see something that's not covered on the list, then you are required to pay for it yourself. And now we'll move on to Part C.
Cheryl, you ready?
Yep.
Part C, component of the Medicare program. It's like the traditional alternative to the traditional. What it means is that you have Medicare, plus you will also pick whichever program you would prefer. One moment, please. So it would all depend. Okay, now we're talking about Part D. This coverage You know, your medication is outrageous. It is so expensive. The pharmacy companies have just really upped their prices of their medication. So since 2003, Part D was passed. They have to offer this option to the people who are on Medicare to get a reduction of the price for their medication. And that happened, and finally in 2006, it finally took effect. Now, we're going to move over to Medicaid. That is the most standard that is used insurance program in the country. It tends to cover, can you show the next slide, please? Again, we're talking about the Medicaid. Perfect, thank you. Okay, this is covered by the government. You pay into your Social Security, you're into your taxes. This is what it pays for into the government to pay within your SSI, SSDI, and your Medicaid. Who are the recipients of this monies? Well, it could be somebody who is poor, elderly, disabled, children, pregnant women, or parents of young children. Now, there is a criteria that is quite strict. It's not easy to get Medicaid. You have to meet the specific criteria to qualify for Medicaid. Next slide, please. The minimum services that are covered: inpatient and outpatient. Inpatient means that once you go in and you're in the hospital or a psychiatric facility or an alcohol drug treatment facility where you are staying inpatient. Outpatient medical care could be doctor services, getting your lab or imaging services done, like MRIs, for example, scans, x-rays, that type of service. You also get family planning services, mental health, early childhood diagnostics, screening, and treatment services, and also selected long-term care services, including nursing homes and home health care. Okay, next, please. Now, this SCHIP is the State Children's Health Insurance Program. Started in 1997 and is for low-income children not eligible for, the traditional Medicaid program. It could be that maybe their family makes a little too much money, but not enough to be able to purchase their own insurance or to get the coverage that they need. Tens of families' income is below the 200% of the FPL, or whose family has an income 50% higher than the state's Medicaid eligibility threshold. Like, for example, here in California, a family of 4, if they make $100,000, like say in the Bay Area, we're talking about in the San Francisco area, that's considered at the poverty level. Now, if you go to Indiana and you have a family of 4 that's making $100,000, oh my goodness, are you living a comfortable life? You're definitely not in the poverty level. So it's paid in, jointly administered by the federal government and individual state governments. Now we're talking about the Veterans Administration, VA for short. It's part of, within the military, is always ensuring that they'll get their health benefits. And it is maintained and administered by the veterans of the military. And the care is delivered by government-owned VA hospitals and clinics. And our tax monies pay for the military for their insurance. And if veterans doesn't apply to most of us if we are deaf. I don't know of anyone who has actually served in the military. Now we're going to move over to private health insurances. Now, this is what you get through your employer. You have to work 40 hours a week. 20 hours or less, you do not qualify. If it's a contract work, you will not get health insurance. You have to work above 20, or should I say 40 hours a week. Now, the insurance will be provided. It's part of their benefit package to their employees. You get your salary, plus you get your health benefits, maybe dental, possible vision. You get a vacation package and things like that. They have private companies that are both for profit, like Aetna, Cigna, United, Kaiser, and so forth. Now then you have the non-for-profit, like Blue Cross and Blue Shield. And that is one of the largest insurance companies in the United States. It's the most popular insurance that's utilized. They pay for all of the health care. If you need, whoever needs health services, that's what they'll pay for. They'll pay for most of it. For private non-group, they typically pay for people who like are self-employed or retired. What that means, like for myself, I am self-employed. Now, currently, I am under my partner's insurance, under their insurance company. Now, for example, if I decided, if I'm not with my partner any longer and I'm there by myself, then I would have to pay for my own insurance. So I would have to purchase my own insurance. Or now if I retire and I'm retired from work, I would have Medicare, but I wanted to do a supplemental for an insurance. So I would have both coverages. Okay. Now we're going to be talking about public health insurance. Remember, that includes Medicare, Medicaid, and veterans. And it's the pros to this, it provides an affordable alternative over private insurances. And it's affordable. Providers an ever-increasing list of benefits, even if it tries to keep the cost of insurance down. You can get a combination of Medicare plans to achieve a more comprehensive plan. You might want to do your Medicare and do maybe A, B, C, or D, whatever your choice would be. You can get help with other out-of-pocket expenses. If it's not included, you'll be able to get assistance to help cover that. Now, the cons to this, well, you have to be eligible to get the coverage that you need. You have to be 65 and older. You have to prove that you are disabled. So if you are deaf, you'll have to go to an audiologist, have a hearing exam done. So yes, I am deaf. I mean, the list can go on of the requirements. And there are many doctors or hospitals or clinics, if it's a private or like for therapists, they do not want to deal with Medicare, Medicaid, none of that, or C-CHIP or anything, because there's a lot of paperwork. They have to fill out forms after forms, and the billing is so complicated, and they only get paid a certain amount, and it's a reduced rate, so some of them just won't do it. They'll only accept private insurances, and that's it. Or if people who are going to pay it out of their pocket. Now, let's talk about private health insurances. That could be Cigna, Aetna, Kaiser, Blue Cross, United, the list goes on. What are the pros to it? You have more choices to ensure that you get the quality of care that you want. So you could pick and choose. This one fits. So I'll pick that one. Maybe it might have a wider network of doctors and providers. And, maybe I want this doctor. And maybe I prefer this physician or this therapist. And so I would be able to get that. While if I'm with the public health, I couldn't. Sometimes because this is your doctor, this is who's assigned to you. You don't have a choice. Not at all. Now suppose, like for an example, with deaf individuals, there are so many of them that I contacted Blue Cross and Blue Shield of California. Now I want a therapist. And they give you a list of who the therapists are. So there might be 3 or 4 on the list who can sign ASL fluently. Now all 4 of them are all hearing. Well, no. I want a deaf therapist. They're available for deaf counseling center. They have them ready and available. Insurance is fine. Out of network, the fees might be a little bit differently, but it's more accepted. Now with the public health, oh no, tough. You have to stay within the list of providers that we have. That's it. You can't go outside of the network at all. If you do want to go outside of the network, then you have to pay for it for its entirety yourself. And oftentimes that's not affordable, especially if you're under some type of public health insurance. Now, the cons to this, well, the cost is considerably more than public health insurance. Like, for example, if both parents are self-employed, as an example, you have to purchase health insurance for your family. Can easily cost anywhere from $1,800 to $2,000 a month for a family. Or if it's an individual, depends on which insurance you pick, it can be very expensive. It can be $800 to $1,000 a month for one person. Insurance company decides their own rates, and it can be costly. And sometimes the insurance company, even though you're paying the $1,000 or $1,800 to $200 a month or $2,000 a month, they still have a deductible and co-payments. So can you imagine spending anywhere from $1,800 to $2,000 a month, then having to have maybe $25 co-payments or maybe $100 for my hospital room and then another $10 for my medication? I mean, the cost is enormous. And the insurance companies can deny it. Say, sorry. Well, you have a previous health condition. I'm sorry. No. You're denied. And I've seen a lot of news of people having a dialogue about this and why this isn't fair. If I already have a pre-existing health issue, like diabetes or high blood pressure, for example, or other health issues, and you're telling me no, or for cancer, for example, no, sorry, your treatment is denied. So you have to search and search and search to finally find an insurance who will take you. And maybe that will change. Who knows? Insurance companies are still going, with all this political stuff too. So what will happen? Okay, so what will happen if they remove Social Security, Medicare taxes, just like you saw in the news, having all this dialogue, wanting to remove and not having this, or defer your Social Security and Medicare taxes, and just it be gone, completely gone? What will happen to public health insurance? Next slide. it will show, like what I showed you in the slides in the past. So there's 313 million people with insurance. We have a population of 330 million people. And I said 300 million people minus 30 million people without insurance. Now with that, suppose it's all gone. What would it look like? Only 171 million people will be insured. Why? Because they're being insured through their employer or paying for it for them on their own. So people who work under the age of 65, military, are covered by the federal government. So what that means is 171 million people are guaranteed to have insurance. Ouch. 159 million people will be without insurance. Senior citizens, this disabled community, parents with young children, pregnant women. I mean, the list goes on and on. They'll have nothing, no insurance coverage at all. They'll be without if you remove public health insurance. So that means you 20 to 30 years you have worked and paid in for your taxes all of this time. Then you get to your retirement. There's no insurance for you. There's no Medicare. There's no Social Security retirement benefits. Nothing. What will that mean? That you're going to have to rely on your own retirement plan that you've been putting into through your company, or you've been saving. And then once you retire, you're going to have to pay out of pocket 100% for your health coverage. If it costs $800 to $1,000 a month, that's what you're going to have to pay. If your medication is, like, say, you have to take a special med, maybe for your stomach or something, that costs $900 a month, you're going to have to pay that yourself, unless you purchase insurance on your own. And so that's why we need both public and private health insurances. So we would have those two options. Thank you. Wow. That is a lot of information to take in about the public and also private health insurance. Wow. I've learned a lot from you, about the charts and how things work. It was just amazing. We do have a few questions for you from the audience. I think there's altogether 7 of them. So, all right, the first question. Okay. Since health insurance is complicated, do you think it's a good idea to include Medicare, Medicaid, and other private insurance to give the community a webinar that maybe CAD can host, so that the community can have an understanding what the benefits are in regards to private or public insurances? Okay, Cheryl.
Absolutely. I think that's a wonderful idea. The system is so complex, and I am not an expert in each individualized insurance plan. It's very easy to become confused. I get confused myself. Sometimes when I'm reading the plans, I can understand what one will cover or another one will not, but I think it's a wonderful idea to have other experts come in. Also, to have the underwig, somebody that can be clearly talk about the deductibles or what insurance company is responsible to pay and what folks are responsible to pay out of pocket. I think that's a fabulous idea. Okay, well, Kavita's saying thank you so much. I will pass that on to the CAD board. And we'll, if somebody is available, we'll absolutely have them in. We'll let you know. I would love to be in contact with you for that. I'll ask some contacts that I have to see who might be available. Well, we would so appreciate it. So let's move on to number 2. What kind of insurance companies can offer people that are undocumented? What is out there? Shelley's response is saying, really, there is not any. If you are undocumented, any patient can go to a clinic that is funded by grants. Any public hospital will serve undocumented folks. Say they are in a severe accident, like getting shot or being in a car accident. They can go to a public hospital, and by law, they are required to serve that patient. And that hospital must just eat the cost. They will not charge the person. Also, we see a lot of GoFundMe accounts that grow or that are placed around in Latinx communities, in the grocery stores, that try to raise funds to help cover the medical costs of undocumented folks in their community. It's unfortunate, but that is the state of where we're at in our country today. Oh, it is so sad. Where is our humanity on this subject? Where is our humanity? It's so unfortunate. And Shelley's responding, yes, many, many people die because they do not get the appropriate medical care. And that's not right at all. Kavita's saying, yes, it's so sad to see that. It's just devastating to see that. I just really want to emphasize to our audience today, we really have to look inside and find the humanity. But let's move on to question number 3. Talk a bit about deaf chiropractors or deaf counselors, marriage and family counselors. The deaf community that uses their services and insurance companies that pay for them are those people in network. Again, it depends on which insurance company you decide to choose. Each insurance company, private insurances I'm speaking of now, has a list of providers, whether they be deaf counselors, chiropractors, marriage and family therapists, or psychologists. They have a list of who will be accepted on their panel. So if you see your provider on there, then you can go with them. Or you can choose to have that insurance company and choose a provider that's out of network, but you'll have to negotiate those costs with your insurance company. At one time, I tried to set up my own counseling practice in Seattle. And I was ready to address the panel of insurance companies, and I was denied. And they said, well, we already have a signing therapist who happens to be hearing, and they thought that was adequate. And Kavita's interrupting, saying that is not the same. And Shelley responded, yes, I know, but I had to fight with insurance companies to tell them it's different having a deaf therapist to serve the patients of this country. Deaf folks have a limited amount of service providers across the country. And if we listed them all out, they would only take up 1 page of licensed family therapists, deaf licensed family therapists. And think of how many deaf people are across the country that need access, and they are denied that access because of a limited amount of insurance companies that take that. Now, one positive about, I'm sorry to interrupt, Kavita, but there is one
Okay.
positive about public health insurance companies, being Medicare and Medicaid. If you go to a mental health care facility, such as DCCS, GLAD,
Right.
or DeCara, you are guaranteed services because they employ deaf counselors. But now the private industry is where the challenges come up.
Now that goes with the private insurance. Do you think that perhaps you need to maybe get a hold of the National Association for the Deaf to take on this fight with the private insurance companies? Because you're stating within the United States, that would impact all of us. So if you're
Definitely
looking at
something
it,
to consider.
I think maybe we need to get the NAD involved.
Yes, I think that would be a great idea.
So I think this is a perfect time. You know why? Because NAD is going to have their core meeting just next month. I think it's the 1st of October through the 4th. So we could make sure to make that motion for them, for the NAD to, hey, listen, you need to push these insurance companies who are private insurance companies because of your skills, that we need them and their support.
Yes, absolutely.
All right,
My
fine.
full support with
We'll
that
do that.
motion.
It's trust me, it's on my mind and it's on my list. I'll get to it. All right, let's go to question number 4. All right, well, you had mentioned that independent contractors don't qualify for insurances. But what if they work up to 40 hours a week or a day? Can they purchase their own private insurance?
Yes. Yes. Independent contractors do purchase our own private insurance. Insurance companies prefer to hire contractors because they don't want the liability of paying for health insurance and other benefits. That increases their overhead. Say you work for an agency and you earn $40,000 to $50,000 a year in salary. Then you would have your health insurance and benefits and vacation and whatnot on top of that. Actually, let me change that. And let's say you're a college faculty member and you are hired full-time as a college faculty member. And you earn $95,000 a year. They will hire a majority of adjunct faculty as opposed to the number of full-time faculty. And adjunct faculty will get paid $80 to $90 an hour, but they have no health insurance costs.
Right.
So independent contractors can purchase their own private insurance, but that is an increased amount of stress. We have to earn enough money and keep bringing in that business, that contract work, to cover our own overhead, to be able to afford costly insurance.
I do completely understand. Yes. Wow. All right, let's go to number 5. I want to make sure that I understand clearly. Is private health insurance almost the same as a PPO?
Well, let me take this on. This question is really why I think it's important to have insurance companies come and explain their options between having a PPO or HMO. You know, there are increased costs because PPO means preferred provider options. And so there are additional benefits, and I am not the expert in that, in what each company might offer or the difference between HMOs and PPOs. We should have an insurance person to come to talk about
And
that.
I think that would be the best way. I have to agree with you on that. All right, let's go to question number 6. Well, suppose a veteran passes away. Will the veteran's insurance still cover, like maybe their deaf partner or deaf spouse? Will that be covered once their partner has passed away? Whatever is their partner's spouse, but will it still be covered?
I'm not 100% sure on this answer. My father is a veteran, and he collects retirement and enjoys the insurance benefit. When he passed away, my mother did not collect his retirement, nor did she have his insurance. My father is buried in a military cemetery, and they will allow my mother to be buried with him in the same plot. But
no
think it says
or anything?
her name cannot be on the plot. Yeah, but she does not have any benefits or any insurance from them.
Nothing?
My mother has Medicare.
Oh.
Yeah, she has Medicare.
Wow.
Yeah, my mother's income greatly reduced after my father passed.
Wow.
So again, because it's strictly for veterans. But you know, I do want to put the caveat in. I am not an expert in this area. About all of my clients are deaf, and so I've never had to deal with veterans benefits.
Good. Maybe we'll have to do a little bit more research on that and see. All right, let's go to question number 7. I think it's the last one. It said you mentioned, like when it comes to your SSI, your SDI, SSA, if that was to cease or be deferred, that would impact. So, what do we do? What steps do we take to do something to prevent from this happening to all of us? What do you suggest?
Yes, it is very important. I have 2 suggestions. One is definitely to share the wealth of knowledge within the community. We really need to be talking about this more in depth and share the presentation I just had tonight. And secondly, vote. We all need to get out on November 3rd and vote.
Vote on what? What prop should we vote for?
Yes, I'm saying to vote for president in the presidential election. As we look at the candidates now, we need to be ready to vote for president. Voting for somebody that wants to endorse SSI, SSA, SSDI, SSI, all the benefits that come with Social Security. We need to be endorsing candidates that support our community, as opposed to other candidates that want to cut Social Security and cut the taxes. They believe that people are responsible to work and gain an income and pay for their own insurance. So you have to look at both sides of the presidential candidates and make a decision of who you will support. And look at who will support your needs and vote. Also, vote for senators. We need to be voting for governors. I think that would be a good workshop to have, is thinking about the governors for each state. Think about the campaigns. You know, governors
yes.
should be signing their
Definitely.
campaigns so we know who to vote for. Candidate A or candidate B, and knowing their platform. Which one supports or brings more harm to the deaf community? Lots of folks are really not well educated on the political
Right.
goings on, and that really hurts us in the
At
end.
the end of the day, we'll be the ones who are going to suffer the most. So I think that is a
Yep.
great idea. That we need to do something, maybe host a workshop. Now we've got November 3rd, so it's coming close. So maybe we can see and contemplate on what maybe we can take a 1 day, host a workshop that focuses on the different issues at hand that are going on the ballots. And I think that would be a great
Absolutely.
idea.
Yes, absolutely. And I think we should list out the platform for the Democrat and the Republican Party to be very explicit about the beliefs of each party, the values of the Republican Party, that they value small business and lower taxes. I like some ideas on each platform, and I don't like some ideas on each platform as well. But in the end, I have to make a decision about what's best for me and vote for the right person.
Well, absolutely, yes. I have to agree with you, Shelley. I mean, it really is. Our time has run out for the evening, but I wanted to thank you for your time, for your explanation, for this critical information to know, and also to prepare and to get ready for the vote on who to vote for and what presidential candidate will fit their needs. I have to agree with you, yes. I want to thank the interpreters who have been sponsored by NorCal. Also, behind the scenes, we own our air production company that have also donated their time. If you would like to see this ongoing, the CAD platform, please consider donating. Go up to our website, www.cad1906.org. If you're interested in being a member, or you'd like to give a presentation or anything that you can think of, contact us, please. Thank you so very much for all of you who've joined us this evening. Have a wonderful evening as well. Thank you.
Yes, thank you, CAD, for inviting me to talk with you and your audience tonight. I look forward to hearing from you and knowing your thoughts about this very, very important discussion. We are all in this together. Have a wonderful evening.
Yes, we are. And don't forget, we are looking forward to our it's next Thursday, in fact. And also we have another one on the 26th of September. We'll have a flyer that'll be on our website. And there you are.